most of you I think know me. We're here with Pam, and we're going to be doing a filling today using Bellafill. It's our long-term, to a degree, permanent filler that we have on the market for taking in and making spaces that you've lost volume, to put the volume back in, to try and revert you back to the way you looked when you were in your teens and your 20s. Because as we get older, we lose volume, and as we lose volume, we shrink in and things shift and move and sag and whatnot. So by putting the volume back in, we can recreate what you looked like years ago. So the idea is to try and make you a younger version of you, not a version of somebody else. So I don't want you to look like your skin's too tight. I'd like you to look like your skin's healthy again. So with Pam, we're going to start off today. This is a beginning with her. But we're going to be putting in a little less than a teaspoon total of this filler in several places. I've already cleaned her face off, and then we've gone ahead and put some little numbing spots on my entry points so this won't hurt her at all. I'll be using a cannula, which is blunt, so we're using cannula to deliver the medications. I'll just need to make a little needle stick into the skin because the cannula is blunt, so it can't break into the skin. But I make a little needle stick in the skin at my numb spots, and she'll feel me poking and pushing and pressing. But I'm going to go ahead and use some volume to volumize this area in here. And then by doing that, if you can see with Pam's face on this area, when I do this, fill this little groove and fill in through here to give her a fuller cheek, that actually is going to pull this back, and it's going to go ahead and take care of a bunch of this. You don't want to put a lot of volume in here because this is the heaviest part of your face. And I don't want to make this part heavy also. It's going to make you look like a chimpanzee or something. So you want to go ahead and have a demarcation here, but I want to go ahead and do some filling to fill out. It's a liquid facelift. It's going to be a facelift without the surgery, without the downtime or anything with that too. So like I said, I'll do this side first. So Pam, sit up for me for just a second if you would, just real quick. If you can get a straight shot on her so you can see her before. And I'll go ahead and I'll treat this side, and then we'll do another face shot on it and you can see. Okay, thank you, Pam. All right, can you give her something to hold her hands?
Sure.
So we'll give Pam a couple of stress balls to hold. This doesn't hurt, but just the idea that something's going on. So there we go.
There you go.
Now Pam has gone ahead and zoned out. She's never had this done before, so her heart's going 90 miles an hour. She's like a duck, cool and calm on the surface and paddling like hell underwater. So, okay, now she's numb, so this isn't going to hurt her, but I'm making an entry point at my numb sites into the skin.
Okay, Dr. Clemons, we have a question. So now kind of explain to us this area that you're going to treat for Pam today, and why are you treating that area?
Okay, these are areas where your fat pads are prominent when you're younger and you're full. You have a beautiful oval look to your face, but as you lose these fat pads and they rotate around, you lose that oval and become more of a square or rectangular, blocky looking. So I'm trying to put the oval back in. So I'm trying to go in. Okay, we're in, under, down in the skin, down in the fatty tissue. I'm starting to deposit just a little bit of this material in here to go ahead and fill in that groove. So she did have a groove in here. Now we've filled that out. Now we're going to go through that same little entry point.
And Dr. Clemons, why did you choose Bellafill for Pam today?
I'd like to have Pam have something that's going to last her a long time. While Pam's not having a lot of pain with this and everything, I can tell you right now, Pam doesn't want to do this in 6 months, and again in 6 months, and again in 6 months, and get in front of a mirror and watch it just go away. So what I'm putting in Pam with my Bellafill is going to be there for years and years and years and years. The FDA lets us say 5 years, but we know it's really 7 to 9 years that it's lasting. So all the other fillers are 6 months or so, 6 months, 9 months, even up to a year where they're gone. Okay, so we've done 1 syringe, which is 1/6 of a teaspoon, and I filled in this little area here.
Pam, did that hurt?
No.
Not at all?
Okay, now Pam is going to squinch just a little bit because I need to put a little more little numbing spot here because I want to get back into there with a little bit. So I'm sorry, a little numbing spot here with this, but you're already probably a little numb, so it shouldn't be too bad. All right,
No.
Okay, so that spot's numb because there is numbing in this medication. So I wanted to get that.
And how long is this treatment going to last her?
We're going to last probably about 7 to 9 years. Now, with Pam, I'm putting in 5 syringes. 6 syringes is a teaspoon. So I'm putting in a little less than half a teaspoon on each side of her face. Average person in their 40s would need 8 syringes, another little over a teaspoon. In their 50s, 12 syringes. In their 60s, 16 syringes. In their 70s, 20 syringes. So Pam, in order for full filling, would need some more, but we can do it in a stepwise fashion over months or even years to put in however much she wants to get her to the level that she wants. So there's some little areas here, but this is going to give her the biggest wow factor early on, taking care of the areas where she really has lost the most. So like I said, right now we're just kind of taking the rough edges off. This isn't the final bit with her. We're going to be improving the heck out of it in a natural fashion, and her friends won't be able to know what she had done, just that she's looking better. So they're going to love her new hairstyle, or they're going to love the new makeup she's using or something, even though she hasn't changed her hairstyle or hasn't done makeup changes. But it's going to drive them nuts because they know there's going to be something different about Pam. They just can't figure it out, and that's fine.
So she won't have any downtime. She can do whatever she wants to today?
She can get off the table when we finish here and go do taekwondo if she wants to, or kickboxing, whatever. There are no restrictions on Pam.
When will she notice her improvements?
Her results are immediate. We'll come off the table. Well, actually, we're going to show in just a few minutes when I get her. Oh, this is numbed also, so you shouldn't feel to see the Pam. It's instant results. So we'll show you the left side of her face compared to the right side of her face in just a minute.
Is Bellafill a new product? I know a lot of people hasn't heard about Bellafill.
Bellafill was introduced in the about 2007. That's when we started using it, about 2008. It was introduced as Artifill first by a company, the Artifill company, but it changed its name in about 2014 or so because they had it in Canada and they couldn't use the word Artifill in Canada because it sounded too much like another product they had. So it's the same product, but it's been around, as I said. The study started about 2001, 2002. They've still been following these patients all along, so there's about 18 years experience with over 1,000 patients they had in the initial study. So it's the most studied filler on the market. They just published their 10-year safety profiles, which no other filler has, and it's the safest filler on the market also.
Wow, look at those results. You can already see.
Yeah, so we are already, and again, as I said, we're going through our numbed areas, so Pam shouldn't be having a lot of discomfort at all. But, okay.
Now, will she need anything else today?
No, she's going to be fine. We can do other things as far as other things for the skin, to repair the skin, microneedling and whatever. But she won't need anything else today, and there's, as I said, there is zero downtime. Okay, Pam, take a breath. Now sit up for me. Okay, now look straight onto there. You can see where we filled in here as opposed to where she's sunken in here. And we filled in here and started to oval this out where she's flat and very narrow ridge across there. So we're starting to build this out now. So this is a great foundation. And in all honesty, 6 months from now she'll actually look better. And a year from now she'll look better than her 6 months. This one keeps on improving with
Take a
time.
look. Oh, wow, look at that.
My goodness gracious, look.
Yeah, it looks beautiful.
Okay.
All filled in there.
So,
You're pretty good,
yeah,
Dr.
hey, all right.
Good
Not my
job.
first rodeo. All right, so we're going to go ahead and match. Now, what we could do is stop at this point and see if anybody noticed a difference.
Oh, no.
Okay, all right. Then we'll go ahead and The other side, again, she's numb, so this didn't hurt her at all. But the thing with this, because it is a permanent filler, I don't like to come close over filling. I like to underfill and work my way into it. And we can just add on and go as fast as the patient wants within reason. I won't let the patient go faster than I'm comfortable with. But I've done them a month or so apart with repeats. I've done them many months. I've done even years apart. So I've done well over 7,000 syringes in the last 10 years here in the Tri-Cities. So we've done a lot of Bellafill. But again, the difference with the Bellafill is with the Bellafill, you own it. All the other fillers you rent. I love the other fillers. They do great, but they're temporary. Now, you're not going to find Bellafill in very many places because the company really restricts who they allow to do it. I've been doing cosmetic dermatology for over 45 years. So I was around before any of this was even thought about. So it's been fun to watch it develop. It's a great specialty to be in. It's exciting. We're always adding new things on. But remember, when you're getting fillers or anything else, anybody can stick a needle in the skin. Anybody can flip a switch. Take a look at their credentials. You know, they make sure that they have abilities to get you out of trouble if you get into trouble. Now, this filler may not be for everybody, okay, although I have patients in their 20s that I've started filling. Most patients start around their 40s or 50s, but as I said, even in your 20s, you're starting to lose volume and thin out and whatnot. If you never want to have a wrinkle and never want to look old, start coming in while you're young, and we can just keep on replacing, repairing what's going bad with you as you age, as you mature. The Bellafill has 3 components in it. One is a little numbing agent, and so the face is going to be a little numb for an hour or 2 afterwards, so I recommend don't try any soup or anything, okay? But 80% of what we're putting in is collagens, the collagen we used back in the 90s, only a better grade of collagen, but back when we used to inject people with collagen, that's 80% of it, and that gives us our instant gratification. So that gives us the instant fill. Now, because it's a cattle-based collagen and it's a foreign substance, it'll break down in about 4 or 5 months and go completely away, so it's gone. The other 20% that we put in here are little polymer spherules. Think of them sort of as scrubbing bubbles, if you would. And what they're going to do is they're going to make your fibroblast make your own collagen. So as you lose the collagen, again, I'm down in the fat area, so there's not many nerves down there, so she's not feeling pain. And like I said, this is a blunt cannula. You can see she's not bruising or anything. Being blunt, if it hits the blood vessel, it'll push it aside rather than piercing and bleeding. If it hits a nerve, it'll push it aside rather than piercing and hurting. So it's a kinder, gentler way to do this. But anyway, with the, as I said, the third product in there is a polymer, and this polymer is going to stimulate her fibroblast to make her own collagen. So as she loses that bovine collagen, she's going to replace it with her own collagen. So that's why it feels natural, looks natural, because it is natural. It's your own collagen. That's why you're going to see and feel. And natural collagen lasts about 7 years, then you start breaking it down. But what we're finding out is these polymers are still there. They're microscopic. They're the size of a white blood cell. So you can't see or feel them. But these polymers, like I said, it's going to make your own collagen. So as you start breaking down the collagen you made after about 7 or 8 years or so, it's going to stimulate more collagen to be produced. So we're finding out that patients that are 12 and 14 years out, that their have never gone back to ground zero. They're still looking good. Sure, you lose some, but then but you're also breaking down too. So it's, we're turning back the clock. We're not stopping time. So you'll still need to come in periodically with little touch-ups and a few other things too.
Dr. Clemons, how long would she have to wait before she could have more filler put in?
The question is how long to wait before more filler. I like to give it a good month or 6 weeks or so to see how it's doing. If we're in a hurry, essentially she's going to look this way 1 month from now also. So if they're really in a hurry, I can go ahead and do it quicker than that after about a week or two. I don't like to put more than about a total of 6 or 7 at a time though. Just because I like to take my time with it. This is an artistic procedure. You have to vary it based on the person, based on how they're doing. So I can about tell you, okay, what we did, I don't know if y'all saw that or not, but she had a big dimple in here, so I just filled in that dimple with a little bit that I had left. So we have, okay, set it for me now, Pam. Okay, so we've put in 5 syringes. We're done. We've gone ahead and filled this out, Still have a little here, still has some back there. Her temples need some, maybe a little more on there. Open your eyes for me, Pam. Good. Okay, are you hurting?
No, I didn't feel it.
Okay, all right.
I did.
Yay, so this is it. This is, again, the Bellafill, the long-term filler. We've been doing it a long time. If you'd like to learn more about it, come on in, free consultations. Look and see if you're a candidate for it. And special for you guys listening, we're having a big sale this Friday. Okay, it's a filler Friday, and we have Bellafill on a huge sale. So if you'd like to see about if you're a candidate for that. Now, if you've already had some Bellafill, you want to come in, that's fine. Make an appointment for Filler Friday, this Friday. But if you haven't had it and you think you'd like to have it, you're not sure about it, call up, make an appointment tomorrow. Let's do a consultation on you, see if you are a candidate, and then get it at a big discount on Friday. By the way, the cost of our Bellafill is just a little bit more than the cost of our temporary fillers. So you can buy it every 6 months at one price, or pay just a little bit more and have it last you 7 to 9 years instead. So anyway, glad to talk to you guys. Pam, thank you very much.
Thank you.
And we'll talk to you guys later. Bye-bye.